It's the start of Mental Health Awareness Month. We'll be talking about a different aspect of mental health each week, starting with neurodiversity. Mental health expert Dr. Kojo Sarfo joins us live to discuss. Dr. Sarfo, we always appreciate having you on the show. Good morning.
It's always a pleasure to be on. Thank you for having me.
So, Dr. Sarfo, let's start off with the actual definition. What is neurodiversity? What does that include?
So neurodiversity is an umbrella term and is used to cover a group of conditions such as ADHD, autism, dyslexia, dyscalculia, individuals who struggle with math, things of that nature. And it's an umbrella term that we use to describe people whose brains think a little bit differently, so neurodiverse. And I love that term because as somebody with ADHD, that allows me to spread awareness and help other people learn about the lives that we live.
Okay, so neurodivergence. What is the difference between a neurodivergent brain and a neurotypical brain?
Right, so neurotypical is what we associate with the word normal. And I'm not exactly sure what normal means, but a neurotypical brain, would do things the way that we would all kind of expect somebody to do it. Somebody who is neurodiverse, take, for example, an individual with ADHD or autism, they may have different needs, in the way that they think, learn, and behave. So an individual who is neurodiverse might struggle with sensory difficulties like loud noises could frustrate them or bright lights. So it's important to be sensitive to things like that.
You kind of touched on it a little bit, some of the challenges that neurodivergent people face. What are some other examples of that in their daily lives? And also, how do these sorts of challenges affect their mental health?
So thank you for asking that question. There's so many challenges. For example, take the individual with ADHD who may struggle with getting to places on time. Things like that can affect your self-esteem, and it can make it hard for you to feel good about yourself. Also, we could take somebody, let's say an individual with autism who is struggling to be accepted socially. If you have a hard time making connections, the evidence shows that people who are able to build long and meaningful and deep connections with others, that is a key to living longer and to improving your mental health. So when you think differently from other people, and maybe this is how you process time, maybe time escapes you too fast, maybe you don't make eye contact with people, maybe you do things that people will label as weird. That's what a lot of neurodivergent individuals struggle with. When you do that, it can affect your mental health in so many ways. And I guess one word to describe it is kind of isolating because a lot of people don't understand you or the experiences that you go through.
Yeah, there's very different cases, so it's a little bit difficult to have an umbrella, strategy for helping every individual. But how do you usually work with these people in your practice?
So the most important thing is for that person to feel good about themselves. So when you take the term neurodivergent and you break it down to the person, you're pretty much telling them that your brain works differently from other people, but it's neither good or bad. But the most important thing is for you to figure out what you need to make your life a life that you're proud of. So a neurodivergent individual, we all have to ask for help in different ways, but you may need a different set of skills that you have to ask for. So if you're somebody and you're struggling with social connection, having somebody who can talk to you and help you make friends with people, help you compliment people, help you initiate conversations that can be helpful, or even something as practical as talking to your teachers at school and letting them know that you struggle with comprehending information. You might want some extra time on tests and the different accommodations that come with being neurodivergent. So it's important for you to accept your brain first and foremost. You have to love and understand the person that you are. And then from that point, you have to go out and seek the necessary help that you need.
I think that's very well said. And Dr. Sarfo, you've been on our newscast before talking about how you yourself have ADHD, which actually falls in the neurodivergent category. What is something that we get wrong about people who are neurodivergent?
I think a lot of times people who, when you think of somebody who's neurodivergent, you might think that they're weird and, they do things differently and that they don't know what's going on. But more than likely, they've had to adapt to the neurotypical world. So things like masking, masking is a phrase that we use to describe people who do their best to fit in, right? So you might downplay some of the quirks that you have so you can fit in with the neurotypical world that we have. And it's frustrating when you're trying to fit in and do things in a different way that's not native to you. So if you have ADHD and you have a certain way of getting things done, you may alter that just so that people don't think that you're weird or that you don't look differently from other people. So I think it's so important to allow people who are neurodivergent to do their thing, and give them the help that they need. But it's very important for us to accept ourselves first and foremost.
And speaking of ADHD, many people have been struggling to fill Adderall prescriptions for months due to a current shortage. Are you seeing that in your practice?
Yes, it's been very difficult. Back in October, the FDA said there's a national shortage on Adderall and other related ADHD stimulants. And it's frustrating because people with ADHD know how difficult it is to get their medications. Even when there is no shortage, it can be hard for you to pick up your prescriptions on time and then remember to take it, and then do your best to have a productive day. So the shortage is everywhere and it's affecting everybody. And it's frustrating because ADHD is kind of like an invisible condition. So you can't really see it. So I've had patients tell me things like, oh, I feel bad for myself. But, there's people out there who have cancer who need the help more. And sometimes you downplay the help that you need. But I think it's very important to not only to talk about these issues because it's a life-saving medication. I think it's the best medication that we have in all of psychiatry, but a lot of people cannot access the medication right now. So talking to your provider about alternatives, whether it's a non-stimulant or a behavior modification, is very important to have a plan because to just take somebody off of a medication through no choice of their own, it can be a very terrible thing for that person.
Yeah, it can be very frustrating, very challenging to go through day-to-day life. So can you expand on what other recommendations you have for people who are currently struggling to fill those much-needed prescriptions?
Right. So the first and most important thing to do is to talk to your provider, and your doctor, your psychiatrist. There's a game plan that we use to prescribe medications. So if there's no Adderall or Ritalin or Vyvanse, there's so many more things that we can do. We can use non-stimulant options like Strattera or Wellbutrin. These are not stimulant medications, but they've been shown to help out a lot of people with ADHD. Sometimes we use beta blockers as well. So sometimes we have to get creative and mix and match in order to help our patients. But behavior modifications are very important. Teaching people how to be proud of themselves, and how to speak to yourself in a kind way. That's important. Exercise is also something that is very helpful for not only everybody, but also people with ADHD. So having a plan is probably the most important thing that we can do. So that might be leaning on our coping skills, and that might also be, talking to other people who have ADHD, figuring out what hacks you can use. Sometimes I'll post online different tips and tricks, such as maybe just even keeping your shoes on throughout the day and working around other people to keep you productive with ADHD. So without your medications, it can be very difficult to just function in the way that a neurotypical person would do. But as long as we stay together and we feel good about ourselves, we can make some progress until we get the medications that we need.
And it sounds like there are a lot of options to get through that part of the journey. So Dr. Sarfo, we appreciate you. Thank you. You always have really helpful information.
Thank you for having me. I appreciate you.